Welcome to another edition of Back Talk, brought to you from the Southeastern Studios in Mount Pleasant, South Carolina. Each episode, you'll hear from board-certified physicians as they explore the latest in medical procedures that are now helping get more and more people out of pain and back to their active lives.
You know, you were asking other innovations or other changes. You know, one of the things that's really new that's come along in the last year and a half is this intracept procedure. And I'd say there's still maybe a little bit of skepticism within our practice about the intracept procedure. But I was very skeptical of it initially, but I've definitely been sold on it. I've had some really unbelievable outcomes. And for people that don't know, intracept is a new procedure where, and it has to be in the right patient, where the vertebral bodies, which are the bones in the spine, get inflamed above and below a disc that's degenerated, which almost all of us get degenerated discs as we get older. And it turns out that there's a nerve in the vertebral body that was only recently discovered, and I can't remember the exact year, but you know, we think as physicians that every single nerve in the body has been discovered and documented and put in the textbooks, but the basivertebral nerve is a nerve that was discovered. I think if memory serves me, about 15 years ago was first documented, and it's a nerve that goes into the back of the vertebral body and then spreads out to the end plate of the bone on either side. And so when the bones get inflamed from a degenerated disc, the nerve gets irritated and it hurts. And
I think that most people, including probably most doctors, think it's an odd concept that nerves would exist inside of solid bones.
Right.
But obviously they do, because nerves are in every fiber of our body, right?
Right. And it hurts when you fracture. I mean, we've known for years that it hurts when you fracture a bone in one of your vertebral bodies. It's extremely painful. But it turns out you can burn that nerve. You can, tap a needle into the bone, and it takes typically 7 minutes of operating time per level to burn the nerve in the bone. And in patients that are sometimes older patients who have very degenerated spines, who have been through every imaginable treatment for their back pain, with the exception of surgery, and sometimes even in patients that have had surgery, they just didn't really have any other options. And so we can do this procedure. And even in younger patients who are trying to avoid a bigger procedure, the basivertebral nerve ablation, or intracept is the commercial name for it. I think it's a game changer.
Right. When people have disc degeneration, that's where the disc loses its water content. That's when, if I call the disc an oyster, is when the disc looks like an oyster in the sun, right? It's lost all of its watery cushion, and the two vertebrae.
Kind of like the oysters my dog eats on the dock, that kind of oyster. Yeah.
Well, I don't know if he's eating, old oysters, right?
Well, the otters bring the oysters and put them on the dock, and then the dog goes and eats them, and then jumps on us and licks us, and
That's a lot. That's a lot. But anyway, when the disc wears out and it's bone rubbing against bone, I don't think that most people understand that when you do a test called an MRI scan, that it shows an actual bruising inside the bone, right? That's this edema. That's this bruising that you see, and that's as a consequence of these nerves being inflamed.
Right. Well, I think that's one way to look at it. But there's actual inflammatory cells in a reaction going on in the bone that is inflammation. The disc itself, when the nucleus or the center of the disc starts to break down, some of the nucleus actually migrates into the bone. As the pressure increases in the disc and the disc starts to break down, little pieces of the nucleus migrate into the bone and create an inflammatory reaction with the bone marrow cells that are inside the bone, and that's and then the nerve is right there. So it's an inflammatory reaction that you know, like you're saying, you see it on the MRI, and that was not really well understood until very recently.
Right. And again, maybe this bears repeating, but when you do this intracept procedure, it's not an open incision, right? This is something that's much like a needle stick,
Right.
or what we call a trocar, which is a hollow needle that's placed inside the bone.
Right.
And so the operation is not one where you take a knife and cut into the skin. It is a needle type of surgery. And the other thing I think that is unique to the intracept is that there's no specified period of recovery.
Right. Well, I mean, of course it can, you know, when you do the procedure, it can cause some soreness in your back that's, you know, lasts for a couple of days. But I tell patients they can resume normal activity basically whenever they feel like it, which, you know, is very different from what we tell patients after surgery. You know, we typically tell patients 4 to 6 weeks of not strict rest, but just walking as your main activity. And with the intracept, you know, you can go back to, you know, kayaking or you know, walking or exercising as soon as you feel like it.
And this is something that is being offered as an alternative to low back fusion surgery. Is that right?
I think that's a fair way to put it, but I think, you know, I think some patients will go on to need a fusion procedure or some other, you know, more traditional surgery. I do think that it is a great procedure for younger patients that are trying to avoid more major surgery. And I think it's a really good option for older patients that maybe not as physically fit enough as they could be to undergo a more extensive surgery, right? Or they may have other medical problems that would prevent them or increase their risk for complications from a longer anesthesia. So I think there's a place for it. It doesn't work in everybody, but I think the indications for it are pretty broad.
Well, I think it certainly speaks to me that as it relates to treating older patients, that Medicare has come to accept this as a reasonable thing to try, right?
Right.
This is a procedure that's approved by Medicare.
Yeah.
Like a lot of newer procedures, it has to go through an approval process.
Right.
And typically Medicare has been the last man standing in these approval processes. Oddly, Medicare has been the first to embrace this concept, I think largely because a percentage of people that are older and are having it done are avoiding having a bigger operation.
Yeah, no, I agree 100%. Yeah, so bravo, one bravo for Medicare. It's usually you're right, the other way around, that they're so slow to change. But this was something that they've led the wave on,
well,
so to speak.
Let's hope it continues on that path.
We hope you enjoyed this edition of Back Talk and learned something new. Look for other podcasts from Southeastern Studios as we explore the latest in medical procedures that are helping more and more people living in pain get back to their active lives.